Hello everyone, let's talk about the celiac trunk and let's talk about the branches and let's talk about the course of it. So in this image you can see over here the abdominal aorta. This is the abdominal aorta over here, and one of the ventral branches is the celiac trunk, and it is given off from the front of the abdominal aorta at the level of a vertebral disc between the T12 and the L1. And if you remember, T12 actually corresponds to the level of the aortic opening of the diaphragm, via which the aorta enters from the thorax into the abdomen. So the celiac trunk, as you can see, is a very short branch, about 1.25 centimeters long, and if you have a scale nearby you can look at it just to have a bit of an idea so that the length is put into perspective. So it's given off between T12 and L1 vertebral levels at the level of the disc in between the two. From the front of the abdominal aorta, you can see the abdominal aorta has a length of 1.25 centimeters, and it terminates really abruptly by giving off three terminal branches. This one over here, which is the left gastric, this one over here the splenic, and this one over here the common hepatic. The left gastric artery is the one that is the smallest. As you can see from this image, it has the smallest caliber, and this is superior obviously, and this is inferior obviously, and this is right, and this one over here is the left. And you can see it is going upwards and it is going towards the left until it will reach this part over here, which is known as the cardiac end of the stomach. This one is the pyloric end of the stomach. And after it has reached the cardiac end of the stomach, what it is going to do is that it is going to give branches to the cardiac end of the stomach and to the esophagus, and these are known as the esophageal branches. And you can see this one coming off. This is the esophageal branch of the left gastric artery. At this point, it is going to turn forwards and it is going to enter a peritoneal fold known as the lesser omentum. And the lesser omentum has its attachments between the lesser curvature of the stomach and the liver, kind of like this. You can even see the attachment line. You can see this one over here, and over here will be the free margin. It is coursing downwards along the lesser curvature of the stomach, and it is going the gastric branches. It is giving off the gastric branches while doing so. So this is the first branch. Then the common hepatic, which eventually has a name change, is heading horizontally to the right, and it is also going a bit downwards, and you can see it is going forwards as well if you look at the image really closely. And at this point you can see is that this is where it is given off, and this is the point where it reaches the duodenum. So the duodenum starts from over here after the pylorus, and its first part is the horizontal part shown over here, and it reaches the upper border of it. And at this point it gives off the artery known as the gastroduodenal artery. After this it has a name of change. It is change of name. It is known as a proper hepatic, which ascends in the right free margin of the lesser omentum, which I've just mentioned. And over here the relation is very important. It is in fact in front of this hepatic portal vein shown in blue and towards the left of the bile duct. It will then terminate into the right, my apologies, into the left, and the right hepatic artery is so important. So this is an important branch because this is depicting the change of name. So this is the gastroduodenal artery, which is going to course behind the first part of the duodenum, because you can see the course, but you can see it is shown in a very light shade. And this is to represent the fact that it is in fact behind the duodenum and not in front of it. And at the lower border of the first part, it is going to bifurcate into two branches. This branch over here known as the right gastroepiploic, and this branch over here known as the superior pancreatico-duodenal. And this one is obviously going to be coursing in this greater omentum, which is going to be following downwards from the greater curvature, and will eventually be anastomosing with the left gastroepiploic. This is the right gastroepiploic, this is the left gastroepiploic. And as you can see, this is the splenic artery, which I've already mentioned, very tortuous. And the left gastroepiploic is in fact one of its terminal branches, as you can see. And then there is the superior pancreaticoduodenal. In fact, we sometimes say that there are two. There is this anterior one shown over here, and then there is the posterior one, and they're supposed to be coursing in this groove known as the pancreaticoduodenal groove, because the head of the pancreas is over here, and this is a duodenum C-shaped, and in between there is the groove. It is said that the superior pancreaticoduodenal artery is going to be anastomosing with an inferior pancreaticoduodenal artery, which is a branch of the superior mesenteric. Now the superior mesenteric is in fact the artery of the midgut, and that is an important thing to kind of understand. Let's see if we can show this anywhere. Right, you can see the anterior inferior pancreaticoduodenal artery from over here, because this is still the abdominal aorta, right? And you can see the inferior pancreaticoduodenal artery given off, and you can see the anastomosis over here. Now the proper hepatics right hepatic branch is going to give off the cystic artery, which is another important branch, so to speak, and you have to know the name at least. It is going to be coursing behind the common hepatic duct over here in order to supply the gallbladder. So these are all very important things. Now the splenic artery is going to be coursing along the upper border of the pancreas, better seen in this image, because this whole thing is a pancreas and this is the upper border of it. It is going to be passing over the left kidney's upper part and the left suprarenal gland. It will then enter the line of renal ligament, and then will divide into 5 to 7 splenic branches, you can see. And the terminal branches will include something known as the short gastric arteries. You can see this is the splenic artery. It's going to be dividing into 5 to 7, as you can see, splenic arteries, and the terminal part of it is going to be giving off. You can see this one over here, and you can see this one over here, and these are known as the short gastric arteries. Very much a lot of emphasis on short over here, because the part of the stomach mostly supplied by this is the dome-shaped part known as the fundus, and another major branch given off over here is the left gastroepiploic, which courses in the greater omentum, this one over here. So I'm hoping this was helpful. If it was, please like, subscribe, and leave a comment.